Thank you.
Thank you, Anjali. That was wonderful meditation. So I just briefly want to introduce Dr. Shekhar Mayanil. He is a professor of neuroscience and excellent, more than 50 years background in yoga. So that makes him very, a very unique person for talking about yogic neuroscience. And he has written a book on Gravity of Gratitude and published many papers. I always invite him on Sri Yoga, and he has had many sessions on Sri Yoga. And I'm really happy to see that so many of you are getting the benefits of his talk today. I also want to mention that Dr. Shekhar Mayanil is we're lucky to have him visit Maryland on June 10th and 11th. And if you are nearby, please make it a point to see him in person. I have 3-4 events already planned for him, and I'll be sending out the information, and so you are very welcome to join him in person. And then again, he's amazing, not just from a this knowledge perspective, but he has been helping people in so many different ways, and really very happy, Shekhar, to see you on this platform. Thank you very much.
Thank you very much. I really appreciate Sriji. How many of you all believe that Sriji, there is असं काही आपल्याला माहित असणार की हीनयान आणि महायान बुद्धिझम मध्ये जर तुम्ही वाचलं असणार तर हीनयान म्हणजे छोटी वाली बोट आणखी महायान म्हणजे एकदम मॅसिव्ह क्रूज लायनर लाईक do you believe that Sriji is that cruise liner Mahayan? Everybody goes inside and everybody is par. वो भव सागर से पार करने वाले. That's what he is, I think. I mean, the kind of service that he is doing to mankind is it cannot be expressed in words. That's what Sriji is all about. And somehow I gravitate towards such people. I'm so honored to be a part of his organization, and he invites me and I send every time yes, and there's not a I'll figure out how to make time for him. He is such an honorable person. Thank you so much, everybody. Yeah. So I'll start sharing some video for you all. So this can be you can share this video per se as to everybody, whosoever you want. At the same time, you can always share the audio if you feel like, whatever this is everybody's material, so you can steal this material and make it as if it's your own, and whosoever is doing it, that's okay. That's perfectly fine. Okay, so okay. So I will just say a happy Mother's Day to everybody. It's been an honor to the mother. The mother is the ultimate in the universe. There is nothing compared to her. So it's a very beautiful day, and I love this day. I wait for this day for the rest of my life, and this is so wonderful. So let's start something today. The neuroscience behind yoga therapy. This is the topic Sriji gave me. He said, you talk on this topic. So I said, that's perfectly fine. So essentially what he was wanting me to talk about was a neurological disorder and how yoga fit into these dynamics. That's what he wanted to talk about. So I'll just share some of these different neurological challenges that human beings face. Some of them are epilepsy. This is aberrant brain activity. Stroke, obviously, when some areas of the brain do not receive blood because of some aneurysm or some artery, small vessels break down in the brain, so that and amyotrophic lateral sclerosis is where you are not able to use your neuromuscular junctions. So neuromuscular junctions are not working, and suddenly the neurons that make connection with the muscles, they die, and then the muscle also atrophy. So this is one of the biggest challenge happening. The same thing happening to Huntington disease. Of course, this is the genetic disorder. Multiple sclerosis, also the same thing as almost the, you remember that there is a white sheet on the nerves, on the white thing. That particular white thing is missing in this multiple sclerosis. So that what happens is short circuiting of the electrical impulse happens in the neurons. Alzheimer's disease, everybody knows, and Parkinson disease is a movement disorder. Alzheimer's disease is a form of a dementia where people forget things and all that. So these are the couple of health and neurological health disorders that have been the hallmark of World Health Organization. And so what we will learn today is what are the neurodegenerative disorders. I'm not going to focus too much on the other aspect, but except for the fact that I'll only talk about neurodegenerative disorders. And because some, I'll not tell the names, some people have approached me regarding this in the last 1 month or so. And I have had God-given gift, I guess. I think this is not my idea here. I had told them to do a couple of exercises or a couple of yogic pranayama and things like that, and it seems to feel they seem to feel better after that. And that was I shared this with Sriji, and he said, "Why don't you talk about this stuff?" So that's how this whole topic came into the being. So what are the underlying causes of neurodegenerative disorders, and how can we use yogic neuroscience wisdom to prevent or reverse neurodegenerative disorders from manifesting? This is the thing which we almost in some form or the other, almost, not like 100%, in some form or the other, we are in a way headed towards old age, right? So, but then we don't have to suffer. Our best gift to our family is a healthy us. My dad told me the best gift you can give to your family is a healthy you, because then they will not have to worry about you at all, and they will be more focused on their own future and own career, and watching you being disease free will motivate them to become disease free themselves, and this lineage will continue throughout life. And that is exactly what the whole thing is of our topic of today is, how do we prevent this from happening? Okay. So what are neurodegenerative disorders? Basically, it is dementia. Dementia is one of the, Alzheimer's disease is the most common form of dementia. Dementia is when you forget things. And just imagine with me that you are sitting in your bed, and suddenly you feel that you are not in this place, because people moving around you and the objects that are around you seem to be strange suddenly. You feel confused. Total confusion is the first sign of dementia. When people say, your son comes in front of you and you think that, who is this guy? And you just ask some relatively familiar face. And they say, who was this person? Oh, he's your son. Oh, he's your son. After a few minutes, he'll say, again, he'll ask the same thing, same question. Who is this person? So, or where did this object come from? So he'll get angry, panicky, and all that stuff happens. And that is a sign of dementia and Alzheimer's disease. So how can we live longer? Because life longevity is increasing, yet at the same time, we need to become better, right? So how do we stop this from happening? There is another challenge, that is Parkinson disease, which is the midbrain, some area. Substantia nigra is a brain area which does not, which starts to die. And that area is very important for the release of dopamine in all the part of the brain. So what happens is it affects motor cortex, and as a result, the movement disorder happens because of that. So that is another. We have discussed this matter a long time ago in Sri Yoga. So deep, like 2 or 3 sessions I did on Parkinson disease. So There is another one which is amyotropic lateral sclerosis. This particular thing is, I will just talk briefly on this. Now, in all these things, what is happening is the neurons, which are the building blocks of the nervous system, are lost progressively. And how do you track that before they are lost completely? Because prevention is better than cure any day, right? So what is ALS? I'll just briefly share ALS today and Alzheimer, just very briefly. So what happened? ALS is a amyotropic lateral sclerosis. It is a progressive neurodegenerative disorder that affects nerve cells in the brain and the spinal cord. Okay, in the brain and in the spinal cord, the nerve cells are affected, as a result of which there is challenge. Okay, now amyotropic comes from Greek language. A means no, myo means muscle, tropic means nourishment. So what happens is, so amyotropic means no muscle nourishment. So nourishment of the muscle means what? When muscle have no nourishment, it wastes. The nourishment is the neural impulse, the neurotransmitters that muscle, that the new nerve sends to the muscle. That is our muscle, what you call nourishment. Neurotransmitter is the muscle nourishment. Of course, it uses calcium, other proteins and everything else, magnesium, calcium, sodium ions for muscle contraction and all that. But the real contraction happens without the nerve impulse. The contraction doesn't happen. So we need muscle, nerve impulse. So when the nerves that bind, when they connect to the muscle are degenerated somehow, then their muscle gets lost. On the flip side, if the muscle is losing itself, in the form of, let's say, if you are on statin drugs to lower cholesterol, what happens in those cases? The muscle gets degenerated, and as a result of which the nerves don't get nourishment, because there is a bidirectional movement of nourishment from muscle to nerve and from nerve to the muscle. So I have had some friends happen to have this challenge, that the muscle challenge was going on. And so what happens is, when the muscle challenge is going on, which means the nerve is not giving it nourishment, and if the nerve challenge is going on, then the muscle is not giving enough nourishment. So both bidirectional thing has to happen. So the lateral means the region of the spinal cord, actually, where, so what happens is, when you just imagine one thing, the dorsal part of our body, the dorsal part of the body is a sensory aspect, right? It is a sensory nerve go along the spinal cord all the way on the dorsal side, and the ventral side is, it is the nerves which emanate from the motor cortex, this part of the brain. Okay, this entire part of it. The motor cortex sends the nerves all the way ventrally into muscles. So that part. So whenever there is, if you experience anything of that nature, the backward bending exercise is very important. The backward bending yogasanas. So I'll share with you some of these things. So sclerosis means scarring or hardening of the region in the area. So what happens is, when the nerves are damaged, or when nerves are some kind of degenerated, muscles don't get nourishment, so they get atrophy, and after some time they harden also. That is called sclerosis. Okay. So what are the early symptoms of ALS? Difficulty in walking, weakness in hands and legs and feet, slurred speech, which is because muscles, the tongue is also a muscle, right? So that slurred speech can happen, or even singing. Somebody who is a good singer throughout life, and suddenly there is a shakiness in the vocal cord. That also can be a indication. So swallowing difficulty, because whenever you swallow, you use muscles, and those are smooth muscles actually. That also gets affected. Of course, um, lungs are also affected, because the diaphragm is a muscle, so there is also challenge. So that's all different kind of situation can happen. Uncontrollable crying or laughing, that also happen. That is, I think, that is a good thing anyway. But difficulty holding the head up. Now, have you seen people walking droopy shoulders, or these are the couple of signs that you can think that there is some kind of a challenge that might be happening down the road. Sometimes some of the things that we see on regular level, we do not give importance to it, but those are a couple of things we should be thinking about also. Cognitive impairment is another one. Now I'll tell you something which is just a brief. Now don't get scared with these diagrams. All I'm telling you is this black one is the one which sends sensory input to the brain through via dorsal root ganglion. So on the dorsal side, these nerves from entire body system, from the skin and everything, they go into the brain dorsally, and in the brain over here in the motor cortex, the nerves come all the way into the spinal cord ventrally. So ventral area is a motor thing, and dorsal area is a sensory nerve bundle, right? So this is what it is. So this is all I'm sharing with you, right? And when so whenever we do yogasanas, the goal is to make this spine twist in both the direction, forward, backward, or lateral also. Lateral, forward, backward. These are the couple of things that we do. Why do we do this? Because these are the nerves that are emanating from that. If they get pinched, or if they are not, if there is a compression, then these stop working. The nerve impulse don't follow nicely. As a result of it, the muscles don't get enough trophic factors coming from neurons, which make the neuromuscular junctions. And that is the reason why these starts to happen. Even though they may not be mutation or any genetic challenges, still we can create our own illness because of our own lack of understanding about how the spine works. So when Srikanji teaches you various bending exercises, there is a very serious neuroscience behind it all. Okay, so just want to share with you that. ALS is a motor neuron disease. This is the normal situation. This is the nerve cell, and this is the myelin sheath. Myelin sheath is a white sheath that is on covering the neuron, and this is the neuromuscular junction. So any action potential that comes from the neuron will activate the muscles, and that's how the muscle activation happens. In amyotrophic lateral sclerosis, the nerve cell starts to die. Now, what happens is nerve cell themselves starts to die, or the myelination or the myelin sheath starts to degrade because of some cells that are sitting on top of it. Those cells are known as oligodendrocytes. Okay, so when these die, the muscles stop contracting. Now, this is exactly what this is in brief. That is, in normal cell, there is a good muscle contraction going on, whereas in ALS, there is less muscle contraction going on. So prevention is in any way better than cure. Always. So we have to see what all places we are happening. So backward bending yogasanas. For instance, you have this in the Surya Namaskar, the second pose is backward bending. Be as much backward bending and with deep inhalation. Deep inhalation, backward bending. And whenever you do this particular Bhujangasana position, seventh position in Surya Namaskar, this is very, very important to create what happens. Whenever you do backward bending, you are actually activating the ventral part of your spinal cord, which are carrying what? Motor neurons from the brain all the way into the body. Understand that? So any motor challenges, motor means movement challenges, can be solved by backward bending exercises. Droopy shoulders are a first sign of neurodegenerative disorders. To be very honest with you, this might be a strong statement, but I am not apologetic about making strong statements. Droopy shoulders, walking droopy, bent walking is the first sign of neurodegeneration, because it does not allow activation of the motor cortex because of, I'll tell you how this, because of vagus lack of vagus nerve activation and subsequent brain activation. So these are the couple of signs I will share about. These are Ustrasana, means camel pose. This is very important pose for activating the Manipura chakra and Anhat chakra as well as the Vishuddhi chakra. This is very powerful asana, yogasana. Everybody must do this at least 3 minutes, 2 to 3 minutes with deep breathing. Then Adhomukh Svanasana. Adhomukh Svanasana is another. This is deceptively simple yogasana, but you know what? It stretches your entire back big time. Very, very. So this when you do this yogasana, you try as much as possible all the way bending forward, but at the same time not touching your chest to the floor. So this is very strong yogasana which stretches your backbone left and right big time. It stretches the backbone real well. And of course, Anjaneyasana is one of my most favorite yogasana. And it activates all the 7 chakras at the same time. Dhanurasana, another one, very, very powerful asana. Bhujangasana and Marjaryasana, which is cat-cow position. So you just inhale when you are doing this sprint, bending, backward bending almost like. And then when you are exhaling, when you are doing the hunchback position, you are exhaling. This is one of the backward bending yogasanas to prevent any motor neuron challenges. Motor neuron challenges happen to be Parkinson is one of the motor neuron challenges. ALS is the motor neuron challenge. So these can be solved by these methods. There is another one which is spinal twist. Spinal twist is Ardha Matsyendrasana is one of the spinal twists. Parivrata Trikonasana is very good. So you can do at least 50 of this left, right, constantly, 50 early in the morning, first thing in the morning. This is very good to do. So what happens is it stretches your back and stretches your spinal cord. It activates your Swadhisthana chakra as well as your Manipura chakra. This yogasana is very, 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 very good. And of course, Vrikshasana. Vrikshasana, you can do this position, and after that, what you can do a twist. While standing, you can do the twist so that you can have your the spinal twist, the backbone twisting left, and when you change the position to right leg, you can twist it the other side also. Okay, so this is very, very important. And of course, you can, when you stand erect, what you can do is you can take your hands, and instead of bringing it in front, bring it backward like that. So when you bring it backward, there is another set of muscles, shoulder muscles, which get stronger and very, very important. I do not know how many people have had a frozen shoulder. Frozen shoulder is because of the lack of muscles being used, some of the shoulder muscles being used. So this cold shoulder or frozen shoulder can be treated by this mechanism. Because of these things, we are basically flushing our lymphatics. Lymphatics is I don't know how many people know about lymphatic or lymphatics, we can call it. Lymphatics in the brain. If there is a tissue, right? We have tissue all over. Tissue releases toxins, right? All the garbage that is bad for the cell is released outside, and outside it is held together by extracellular matrix. Okay, the stuff that is sitting outside the cell, and those things get collected very close to the blood vessels. So blood vessels, they are not yet, because when you sleep at night and when you get up, you feel very groggy and very uneasy. That uneasy is because of that accumulation of lymph or the lymphatics, right? So that lymphatics contain all the toxins and this and that. So it has to get transferred into the blood first. And when you do yogasana like these especially the Vrikshasana and the Parivritta Trikonasana, Ardha Matsyendrasana, what happens is lymphatics get drained into the blood vessels that go into the heart, and it gets detoxified into the liver and then sent back to the kidney for excretion. This is very important. So these are the couple of things that the logic of doing this is amazing. So abdominal compression is another one which I cannot overemphasize. The abdominal compression causes Manipura chakra to be activated, and Manipura chakra, for a healthy living, if you can handle 3 chakras well, just 3 chakras, the root chakra, and the Swadhisthana chakra, the Muladhara, the Swadhisthana, and the Manipura chakra, if you can handle 3 things well, you will live happily and healthy. After that, if you would like to use this happy, healthy living for advanced meditation and realizing your true nature, then the Anhat chakra and the Vishuddhi chakra and the Agya chakra and the Sahasra chakra, these are the couple of things that gets finally activated if you continue doing the yogasana at the same time doing the meditation that was just before the. I felt like I just can't sit there for like that forever. Why am I talking like this? That is the secret. We started with the secret actually. So anyway, so there is another halasana is another one. All these asanas do activate our Manipura chakra. So Manipura chakra is very, very, very important chakra for activation of vagus nerve, because at the belly button, the vagus nerve is the peripheral most. It is one of the 10 cranial nerve coming from the root of the brain next to the spinal cord. It starts from there and it is going all the way in the body. It is vagus nerve because it is the vagabond. It just goes everywhere, right? But at the same time, it has double movement of action potential. It is efferent and it is efferent, both. So that's why it is when you activate your Manipura chakra, the vagus nerve gets activated, and when it gets activated, what it does, it activates the entire brain also. That is the power of vagus nerve. When you eat well, you feel fulfilled, vagus nerve gets activated. When you do yogasana, this kind of yogasana where you compress your abdomen, where vagus nerves get activated. There is another one which I have, Adhomukh Sukhasana. This is what it is. So when you sit down like that, and then you bend your head and touch your head here, and do deep breathing while in this position. There is a second variation of this where you can make a fist and put it next to your belly button, abdomen, and then go and touch your feet, your head to the floor. This way, what happens is the Manipura chakra gets really, really, really good activated. It's fantastic. And of course, Balasana. Balasana is another one which can be used. But you have to do this when you in this position, keep doing the breathing. Don't just do it and get up. Keep doing the breathing in and out, because you will know you cannot breathe deep in this. But then whatever is, it will reach the crevices of your lungs. Almost all the parts of your lungs will be filled up because of this. And then you can do Shashankasana. This is a very powerful pose which activates your thyroid and the Vishuddhi chakra as well as the Sahasra chakra. This yogasana is extremely, extremely powerful. And Janu Sirsasana is another one where you can touch your heel to your Muladhara, and then you bend like this, exhale, bend, and then keep doing the breathing here. Keep doing the breathing. So this is one of the things. You can do 10 breathing and you will be like, wow. So anyway, second thing is dementia, also known as senility. Because they say na satya gaya is senility actually. Broad category. It is a broad category of brain disease. Long and short-term memory loss happens, and it is purely because of degeneration of neurons. And I'll tell you how that happens. And Alzheimer's disease is a common form of dementia, where you see emotional challenges because nobody understanding you. Neither you understand others and or other understand you. That is the biggest challenge happen. Language challenge. You cannot speak. Actually, the worst part of it is you know that you could speak and you cannot speak now. That anger, I have seen in 100% of the Alzheimer or dementia patients, and they have been the most holy cow people, very nice, gentle, thorough, gentle person. And the moment the senility or the dementia hit, they become most angry. They use foul language of all the things that they might have learned in their teenagers, and at this time they start again the same thing. And the worst thing is that they lack motivation to do anything. If you tell them, okay, why don't we take a walk, they are not more interested in that. So anyway, so this is the structure of the neuron. That I'll just share with you. And these are a couple of, this is a neuron axon, and this is the myelin sheath that is, and then it makes connection to another neuron, so they talk to each other. In Alzheimer's disease, either this neuron dies or this neuron dies, so that there is no further communication. The action potential, they call it a communication. It is an electrical impulse which travels from one neuron to another neuron through by making connections. So there are all the way connections are made and the entire networks gets fired up. The cause of dementia, the only cause of dementia according to Mayo Clinic is damage or loss of nerves and the connection in the brain. So there is loose connection. Now we can rescue loose connections by doing a couple of things. But once the connections are lost 100% and the nerves are dead, nerve cells are dead, then there is no hope. So, but our yoga techniques and all the techniques that Sriji teaches is amazing. And it can, if there is somebody in your life, I think this seminar should have had people from 35 years to 45 years. The maximum people should have been listening to this seminar is that age group, because it is that during that time, bad living or irresponsible living can cause challenges. The seed have been sown during this time, which will have effect at the age of 65 plus. So I strongly recommend whosoever has the video or the audio, please share it with your children who are at that age group, or they will. I am sorry to say, but they will because of the present work style, the present day living style, and the Western cultural style, and non-interest in yoga or some of these challenges, they will face challenges like that. So how many people you see walking on the street with the handheld device, whatever that is? So they are always bending like this. They're walking half hunchback almost. They are the ones which are down the road. They are the potential targets for all these neurodegenerative challenges. How do you, this is a snapshot of the brain. They are not just the brain cells, but there are other cells that are sitting there in the brain. There's astrocytes. These astrocytes produce growth factors, right? And the microglia are the ones which cause synaptic pruning. Synaptic pruning means there are a lot of synapses that are formed, and the ones which are not used proper, use it or lose it. That is the game plan of microglia. If the microglia, if they get activated, which means that brain is not active. If brain is not active, which means neurons are not active, then the microglia are active. What would you like to have activated? The neurons or the microglia? The microglia causes synaptic pruning of those neurons which are not firing anymore. So neurons that wire together, fire together. So why don't we increase the wiring by increasing the firing, or vice versa? So if your any immune challenge that happens or inflammation that happens, the microglia are the ones which get activated, and they start destroying the neuron one after another, and they eat up the neuron. Now, they are actually scavengers of the brain. which means if the neuron sits there by itself and not active, what happens is it can create plaques inside the thing. Microglia's job is to clean up that plaque. So microglia is in some or the in some form or the other very helpful for the brain to clean up the brain junk. But if the brain junk is constantly being produced because of inflammation, then microglia are not sufficient. And at that time, what happens? The blood-brain barrier gets opened up, and macrophages are the cells which are in our body, which are responsible for eating up the bacteria, the viruses, and the dead cells in the body. That is the macrophage's job. So if there is enough inflammation, neuroinflammation going on in the brain because of activated microglia, which in essence is not enough to tackle the inflammation. So what it does is it allows blood-brain barrier to become leaky, and macrophages travel from blood into the brain, which should not be the case, should not be allowed. But in this case, when there is excessive neuroinflammation, as in the case of dementia or Alzheimer, then what happens is macrophages take over, and then they start destroying the live, happy, healthy brain cells also. So anyway, there are more than 6 million Alzheimer's patients, and you can get it in online anywhere. So it affects at the age of 65 and older. That's where it starts. That's what they call it, Satya Gaya Hai Aadmi. That's what they say. And currently, at this time, this is at the pandemic level increase. So now I'll tell you why that is also because of the statin drugs that are with brain only use cholesterol and sugar and ketones as a food, nothing else. I repeat again, brain uses cholesterol for its activity, sugar for its activity. And what we are trained to do, don't eat sugar and don't eat cholesterol, don't eat ghee. Wrong. And then they prescribe what? Cholesterol reducing drugs, statins. What that happens is neuron, the neuron, that the sheath of the neuron, the nerve, which is myelin sheath, is not able to form itself. The neuron itself is rich in cholesterol. The neuron itself, the membrane of the neuron is rich in cholesterol. So you're not providing enough cholesterol for its neuronal biosynthesis or neurogenesis. So what happens? You're providing no nourishment or the building block for the neuron to make. So progressively it will cause this disorder. So statin is one of the biggest culprit for neurodegenerative disorder that we are saying. So how do you go about fixing this? I'll tell you later. So Alzheimer's disease, yes, it can be reversible as long as you can check it at the time of when the neuronal connections are not strong. But the moment that you have to find out, the first sign of slurred speech, the first sign of memory loss, where did I keep my keys, that type, you must start rapidly. Alternatively, you should have started at the age of 15. This whole process would never occur at all. You should start at, that's why I extremely strongly encourage youngsters to start doing yogasan. It is not just for the elderly. I see more elderly people get excited about it because they want to be happy and healthy. But at the same time, they should encourage the youngsters somehow or the other. I don't know. There should be just 35 to 45 age camp with rigorous yogasan camp should be all over the country, all over India and in here also. So I strongly suggest that. Anyway, what are the risk factors? Traumatic brain injury. How many people have had their grandparents fall? And then after the fall, that's it. And they did not recover. What happened? Lord knows. This is one of the things. Now, there is another challenge. Alcohol, 21 drinks per week. How many youngsters are doing this? They are creating their own hell or whatever you call. Smoking, air pollution, stress. insulin-resistant diabetes. If any one of these plus any of this, any one of this and any one of the black ones, if two matches somehow, you can write that down that this fellow is headed towards neurodegeneration. I cannot be stronger than this. This causes neuroinflammation, and once neuroinflammation is a good thing actually, because it protects, it is neuroprotective. But if you give one more of this, then this fellow is no more neuroprotective. It will cause macrophages and they will eat microglia activation, which will in turn activate the macrophages, which should not get inside the brain, but it will enter the brain and eat up all the cells. This is an irreversible stage. This is around here, it is, you can reverse it. You understand that? This is important. So how hypertension is another challenge. Obesity. Hearing now, obesity can be fixed by activating this throat chakra. Less education is another risk factor. If we are not thinking, if you are not making good use of your brain to the best of your ability, you are headed for that. If you're only focused on one thing, just how do I deal with paying mortgage and how do I deal with my bank account, that is least education. That is least education. Can you learn new things? Let's say at the age of 65, suddenly you start to know, I say, I want to learn music. Fantastic idea. I want to learn new Spanish, German, French language, Chinese, for Pete's sake. That's good, great. That is very good for brain. Any anxiety at this 35 age, 36, 37, 40 years of people having anxiety. This is pandemic of the godly, I don't know what proportion. This 11 and 12, depression and anxiety is becoming big time right now. And if because of that anxiety, what they do is they say, man, let's go and have smoke and let's have some drinks. Do you know what they're doing is they are not just doing two things plus three things, three onslaught to the brain. They are causing dementia challenges at the early dementia, early onset neurodegenerative disorder. If you want to check NIH website, this is becoming big time bad stuff for the youngsters. Anxiety, depression, causing them to go ahead and drink. This is the big challenge. And of course, statin, cholesterol. Statin is it should be banned. I think they should ban this. They must have something that, especially people from Indian subcontinent, Asian subcontinent, statin is poison for them because they 100%. If they may say 10%, there is a chances of muscle weakness. No, I consider 100% chances of muscle weakness because of our genetic background. So our genes do not support statin. Statin may be good for Caucasian, but it is not good for Indian subcontinent people. So this is, I just shared with you this. Now, what happens is activated microglia eat up the brain, and this brain is stressed, and this nerve cell is stressed anymore because of whatever that onslaught we have given through one onslaught, second onslaught, third onslaught, diabetic onslaught, you name it. If you have multiple challenges impinging on the brain, what happens is microglia get activated, and this produces what you call glutamate. Glutamate is a very, very horrible neurotransmitter, and that activates this, it inhibits this growth of this neuron making connections with other neurons. The real challenge happens when the microglia activation is insufficient in the brain to produce primary inflammation, or which is basically primary inflammation is the neuroprotection actually. But if it is constantly given another challenge, and then what happens is leaky blood-brain barrier happens, and leaky blood-gut barrier also. There is another. That's why I was impressing upon activation of Manipura chakra, is because we can stop the blood-gut barrier, which is exactly the same as blood-brain barrier. So how many people have had a leaky gut? Leaky gut means leaky blood-brain barrier. There is the exact same constitution and the same neurotransmission. Everything happens. This Manipura chakra is our second brain. It is brain inside, brain outside the brain. If you take care of this brain, Manipura chakra, this brain is taken care of. That's why they said, you take care of your gut or your intestine and your gut, the Manipura chakra, and the brain will take care of itself. Last time I had talked about the Parkinson disease, and 100% people were shocked when I told them that Parkinson disease is not a brain disease. It gets manifested in the brain, but it starts at the gut. And people were shocked. I said, how do you say that? I said, I'll provide you evidence. And I've showed paper from Nature and Neuroscience and Cell on top, the world's top best journals out there. But this information is not reaching the masses. That, listen, man, if you happen to have constipation at the age of 55 and 60, sometime relatively like constipation, at a regular interval constipation, you are headed for a bad deal. Parkinson is going to happen, period. I mean, sorry, this is how I speak it. I don't want to scare people, but I want to scare them enough to do some action. Okay. Leaky blood barrier, systemic inflammation happens. The whole body is inflammation. Everything is inflammation. This is what causes poor brain activation. And once the poor brain activation happens, the cells don't like to live and they just die. And that's what it happens. This is Manipura chakra, which is called the second brain. Now, people challenge me, where is Manipura? There is anything chakra like that? I say, yes, it is. These are white. The yellow stuff is all the big neurons, huge neurons there. And they have the same neurotransmission, or the same neurotransmitter as the brain uses. The brain uses the same neurotransmitter as this. And they are all connected together with the vagus nerve up and going up all the way into this. This is the vagus nerve coming from all over the body, and it is going into this NTS. This is nucleus tractus solitarius. This is, and from there it connects to all the areas of the brain. Do you see how it is going on? Everywhere. This particular thing activates every part of the brain. So if you want to make this happy, make sure your vagus nerve is happy. And how do you make vagus nerve happy? Take care of your gut. Number one, don't have constipation happen there. Number two, activate your Manipura chakra by doing the exercise that or the yogasana which Sriji teaches you. The backward bending, the forward bending, and sideways bending, all that good exercises. The yogasanas are lifesavers. If you don't do it, I am sorry. So persistent activation of neuroinflammation is amazing. That's why it said anybody who has these, and along with this, one more, headed for a weak brain, which will 100 billion neurons are going to say goodbye to each other. How do we reverse? Intermittent fasting is very important, because instead of letting the macrophages or the activated microglia take care of it, fasting does is it eats itself. It cleans itself. The brain cleans itself, and the infiltration of macrophages do not happen because of compromised blood-brain barrier. Because if the brain is cleaning itself, why do we require macrophages to clean it up? So intermittent fasting is very, very important, where what happens is it lowers the insulin level in the body, right? So insulin is a cytokine which is basically, if it is sitting in excess, it will cause neuroinflammation. Okay, So this is, so increased insulin shuts off autophagy. Autophagy means eating itself, cleaning itself. That's why we have in India, our Aji and I used to do Aaj Somvar hai, Aaj Gurwar hai, Aaj Mangalwar hai, that type of thing. This is what they were doing it. And they were not knowing why they are doing, but does it matter why they're doing? They are doing great things anyway. And just follow them. And if you want to know the logic, you send them to me. I'll tell them the logic. Manipura chakra activation is another very, very important. It increases brain-derived neurotrophic factors. This is very, very important. Brain-derived neurotrophic factors as well as the growth hormone, which increases neurogenesis in the brain. Now, this particular site have at least 100 publications, which I can cite, but I'm just summarizing it just for your purpose. Vagus nerve activation. All the yogasanas that are backward bending asanas, press the abdomen, and as we have discussed earlier, they are the best for vagus nerve activation. Or when you push your abdomen with this with your fist and bend and touch your forehead to the floor, that is the best way to press against, because the vagus nerve is most peripheral around the Manipura or around our belly button. Ujjayi pranayama is direct brain activation. Bramhari pranayama is direct brain activation by activating the neural stem cells. This is what it is. So I'll just share with you how Ujjayi pranayama. Ujjayi pranayama, what you do is you constrict your throat a little bit, right? So constrict your throat, and so what happens? There is a small area in our spinal cord area which has no bone. So when you constrict it, that vibration goes into the pons and medulla oblongata, and the pons and medulla oblongata contains several regions which are activated by breathing, and those are the 5 centers of our breathings. And these are the 5 basically. In the pons there are 2, and in the medulla oblongata there are 3 centers. They get activated, and they are the ones which send all the fibers into the brain. Okay, so when you are doing the Ujjayi pranayama, basically you are activating these nerve centers, which has connections to different part of the brain, controlling 5 major bodily function. Abdomen. So this is what it is. So this particular thing gets activated here because of that, and there you are. So what happens is prana, apana, vyana, samana. This entire area of Agya Chakra. This whole thing is Agya Chakra actually. This area of the Agya Chakra which control prana, apana, vyana, samana, and udan, and this is like, so when you're breathing in, it gets bifurcated or pentafurcated into pancha pranas. And pancha pranas are nothing but 5 functions. Physiological function is known as pancha prana. What are these pancha prana? Water balance, which means excretory system; eating behavior, which means digestive system; respiratory system; and of course the brain and your immune system. So these are the couple of things that actually do the job. So this is temperature control and water balance. You can take a snapshot of this if you want, a screenshot to keep it with you. Eating behavior, urinary behavior, all these behavior are controlled by what? Ujjayi pranayam. Ujjayi pranayam controls. Ujjayi means one little constricted throat, breathing, deep breathing. At the same time, your breath become pancha prana by activating these 5 centers in the medulla oblongata and pons region, and that basically they have fibers all over the brain controlling all that stuff. So I just did not draw out the fibers here, but here it is. You can say this from here. There is a hypothalamus which get activated, and this whole thing get thyroid stimulation happen. Pituitary stimulation happens, cardiovascular stimulation happens, everything is happening. Inspiration, expiration, all this is happening together. And all the pancha pranas are basically getting fired up. So that is the beauty of it. So breathing is the only, or the pranayama is the only conscious involuntary phenomenon that can be controlled voluntarily. Breathing all the time happens, right? You don't need to think about it. But when you do the pranayama, which means conscious breathing, then you can consciously control all the 5 pranas in our system. When the 5 pranas are happy, do you think your body, do you have any worry about your body? No, you don't worry about your body at all. When you are totally oblivious of your body, that is real dhyan, that is real meditation actually. And when you're totally oblivious, that is the whole essential idea of all the yogasanas and pranayama and all the good stuff, is to be totally oblivious of your body. The baby, a small baby is so happy. Why is he totally oblivious? Even the ant crawls on his hand and he bites. He doesn't care about it. If the snake comes and sits next to him, he's not worried because he's no body conscious. He is not worried about his body. That is why he is so happy. So if you want to be happy, let us become totally oblivious of our body. How do we become oblivious of our body? If our pancha pranas are taken care of. How do you take care of pancha pranas? By taking care of your breathing. How do you take care of breathing? By doing the pranayama the right way, as Sriji is teaching every day. So these are the breath being the same denominator, and they have these different receptor types, and they will control all the 5 different pranas. So I'll just Bramhari pranayama. I have already shared this long time ago, but I am going to share with you again. Now Bramhari pranayama, in this Bramhari you make sound, right? You use the sound. What happens is there is something in the brain which is called the lateral ventricle. This is filled with cerebrospinal fluid, right? Now the cells lining this ventricle are the potential stem cells, that which will create neurons down the road. And when you do the thing, what happens is, this is what happens. I'll share with you a video. I hope to. Anyway, just I'll stop share and I'll again share this with you. 1 second.
Okay.
Sorry. Can we share the sound also?
No, there is no sound in this, just video.
Okay.
You love the video because this is so beautiful.
This is so good. I would love to have the entire video. Just
can you see this?
No, we can't. I can't see you.
Okay, 1 second. 1 second.
We would like to have a whole video.
I will share with you right now. Okay, I'll share with you this video. Okay. And share sound also. Okay, good. Can you hear it now?
Yeah.
Yes.
And see it also?
Yes.
Now this particular thing that you are seeing here, this small cells that are sitting at top on the top, these are the neural stem cells that are getting activated from the cells lining the ventricle. These are the ones which create new neurons in the brain all life, throughout life. Bramhari pranayama activates this particular ventricle area and they create neurons, and hence will stop you from getting every time. This is coming, this particular is coming from one of the top notch, the best of the best in neuroscience. So this guy is just unbelievable. Okay. Okay. So I'll share again my screen, which is this one. And okay, so you have seen what happens. when you are doing Bramhari pranayama is one of the most powerful for neuro regeneration. Even if you have had lost neurons, okay, do Bramhari, 5 Bramhari every day. And every time, in fact, if you do 7, it will be better. Then what you do is just almost like say sa re ga ma pa dha ni sa, which means increasing in the frequency. If you do that, almost all kind of frequencies are being sent to the brain for activation of all kinds of neurons. Okay, so very, 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 very important thing. Of course, this is what I was sharing with you. This hippocampus and this particular ventricle, the cells lying, these are subventricular zone cells. These are the ones which create new neurons all life, but we do not know how to trigger it. So what they are doing is they may be doing the deep brain stimulation thing that is mostly available now. They're making a whole lot of money. But let me tell you one thing. You can do a much more beneficial deep brain stimulation by using our Bramhari pranayama technique. One unbelievable, most beautiful technique that ever has been devised by Lord Shiva. Lord Shiva devised this technique. Now he knows, right? He knows. Bramhari is the most fantastic thing to trigger the entire brain. And once the entire Bramhari is the next generation human evolution, because you will need this cortex. This cortex still is undergoing development, right? So if we want a fantastic cortex, you must have a good Bramhari challenge, Bramhari pranayama going on that will enrich your cortex and never ever have any neurodegenerative challenge ever in your lifetime. So why do we have to wait till 65? Why not start doing early at the age of 30, 15 maybe, who knows? 35, 45, all the way you should have this going on. Thank you very much and immense gratitude to everybody.
Thank you. Thank you so much, Dr. Mayanil.
Thank you so
is-
much.
This was
amazing.
wonderful. I do want to see it again and again and learn everything that you said. And I'm going to share it with a friend if you don't mind.
Share it with everybody, the whole, don't worry about this. Just send this video to as many friends as possible. Share it, 1 million views should happen on this video. I'm serious.
Wonderful, yeah.
We are saving,
He's a
we are
neurologist
helping people
also.
get the knowledge of neuroscience and the Vedas and the yoga and Shivji and Parvatiji's discussion and you name it. We are condensing all that knowledge here and sharing with people. We have to share it. We don't keep it to yourself. Please share as much free. And if somebody is an instructor or educator, just you. If you want me to send you my PowerPoint to you, I'll send it to you also.
That is actually one of the...
Yeah. So before we, so that everybody can get a chance to talk, do comments, ask questions, we are going to go one by one.
Yes.
So we have a lot of questions that are already in the comment box. So we are going to start with that first. So Alka, do you want to take some questions? Yeah.
First of all, Dr. Mayanil, thank you so much. Thank you so much for coming here on this platform.
Thanks Sriji. Thanks Sriji and another couple in my life, Aruna and Sham Nawathe. Aruna and Sham Nawathe led me to Sriji and Sriji led me to you all. So I thank all these 3 people. They are the greatest human beings on the planet, and I cannot be immense gratitude.
Thank you so much.
And Alka, before you start, let me announce, because everybody is saying the same thing. हा व्हिडिओ सगळ्यात आधी तर ऑडिओ रेकॉर्डिंग आणि स्लाइड्स या ग्रुपवर पाठवल्या जातील आणि त्याच्यानंतर व्हिडिओ जो आहे तो ज्यांना हवा आहे त्यांना पाठवला जाईल. सो यू आर गोइंग टू गेट द रेकॉर्डिंग, सो डोंट वरी अबाउट दॅट. अँड थँक्यू सो मच. अलका, गो अहेड.
हो, थँक्यू सायली. आणि बाय द वे ह्याच्या स्लाइड्स ज्या आहेत त्या आम्ही त्यांना खास सांगणार आहोत की त्या आमच्याबरोबर शेअर करा, सो वी कॅन पुट इट ऑन द व्हॉट्सअप ग्रुप. अँड आय एम प्रिटी शुअर डॉक्टर मायनिल विल बी मोर दॅन हॅपी टू डू दॅट एज वेल. आणि मायनिल, इज इट ओके डॉक्टर मायनिल की तुम्हाला समजा आमच्या व्हॉट्सअप ग्रुपला आम्ही ऍड केलं तर इफ एनीबडी हॅज क्वेश्चन्स तर
काही हरकत नाही. नो प्रॉब्लेम.
थँक्यू सो मच. आणि बाय द वे त्यांच्याबद्दल अजून एक गोष्ट सांगायची म्हणजे त्यांचं योगिक न्यूरोसायन्सचं युट्यूब चॅनल सुरू झालेलं आहे, ज्याच्यावरती ते हनुमान चालिसाच्या प्रत्येक चौपाईबद्दल प्रत्येक एपिसोड्स वरती बोलतात. तर त्यांचे 7 एपिसोड झालेत. 7th वन इज गोइंग ऑन. सो ज्यांना
आतापर्यंत मी ते पवनपुत्रवर डिस्कस केला आहे. पवनपुत्र, हनुमानजी पवनपुत्र आहे, आपला ब्रेथ पवनपुत्र आहे, आपला ब्रेथ हनुमानजीच आहे, ह्याच्यावर डिस्कस केलाय. याच्यानंतर आता जे 8, 9, 10, 11, 12, 14 त्याच्या मी आता वर चालू आहे, त्याचं काम सुरू आहे, माझा विचार चालू आहे खूप. त्याच्यामध्ये रामदूत, अतुलित बलधाम, रामदूत कसे आहे. आता राम कोण आहे? कॉन्शियसनेस. ते रामचे कॉन्शियसनेसचे दूत आहे. जर आपल्या शरीरमध्ये हनुमानजी आहे तर आपल्या शरीरमध्ये रामदूत कोण आहे ह्याच्यावर डिस्कशन होणार आहे. मेसेंजर.
Yep, absolutely. And that is one of the best episodes. ज्यांना माहिती नाहीये हनुमान चालीसा आपल्याकडे का म्हटली जाते, त्याच्यावरती त्याचा एक म्हणजे त्याचं कम्प्लीट डिफरंट कनेक्शन यू आर गोइंग टू स्टार्ट फाइंडिंग आउट व्हेन यू सी द फर्स्ट एपिसोड. स्पेशली पहिला एपिसोड तर अजिबातच मिस करू नका.
खरं, that is true.
Foundation of everything. But you will get curious as you start with the next episode. अरे पुढे काय आहे? So please take a look at his YouTube channel आणि ते सगळ्यांपर्यंत पोहोचवा, because this is amazing and we have seen the effects of those. So please do start looking into his channel as well. And now going back to our questions, Vandana ताईंचा आणि मिलिंदजी, I think you must have gotten the answer for your question जे तुम्ही विचारलं होतं एक्सरसाइजेस बद्दल. सो वंदना ताईंचा प्रश्न असा होता की त्यांना स्टॅटिन प्रिस्क्राईब केलं गेलंय फॉर रिड्युसिंग कोलेस्ट्रॉल. So the question is, what conversation should she have with her internist about not prescribing, or what is the other option?
Stop statin right away without discussion with the internist. Don't discuss. They will provide you something other than statin, and which is having the same effect as statin. Don't worry about statin. Statin is a poison. Please don't take it. Just flush it in the garbage.
I was asked to take statins 50 years ago, and I said no.
If some doctor wants to argue with me, bring him on. I'll take on.
So I have refused to take it for last 50 years.
Okay.
Very good.
So my question to you, I'm Vandana. My question to you, when I refuse and they say my cholesterol is jacking up, what do I do?
Remove stress first. That is the first thing that causes.
Yeah, I've been doing the pranayama with Sriji, and I do yoga.
And are you doing yoga nidra?
Yeah.
Yoga nidra is very important. And high cholesterol. What is the cholesterol level?
Actually, my HDL is about 95. And my LDL is the issue. And so that's why he's been giving me, and I've been taking it for over. I don't want to make it a
because
personal.
every human being has a different ratio, and they function very well with different ratio. So don't worry about the because statin is prescribed because they want the pharmaceutical industry to make money, and they make fear as a hook. Oh, if you do this, then you will die. It's wrong. There is no such thing as that.
Thank you.
There are better ways to this. For instance, if you eat oatmeal, steel cut oats, it reduces cholesterol by around 40 points. 40 points reduction. 1 week may.
Very true.
And we do deep breathing and exhale. What they call it? काय म्हणतात श्रीजी त्यांना त्या प्राणायामला? Exhale.
You mean
रेचक म्हणतात.
भस्त्रिका प्राणायाम. भस्त्रिका प्राणायाम करा, त्याने कोलेस्ट्रॉल लेवल कमी होते खूप.
Okay. Thank you.
100%.
आणि पुढचा पल्लवी, आय थिंक शी वॉज आस्किंग की व्हॉट डू यू अड्रेस द PD that is gut grievance. I don't know what is PD that means.
PD means PD gut. I can show you that particular. I can do another Parkinson disease workshop on.
Sure.
Some other time, where I have a lot of this, all the scientific data from journals, the pure journals, where they talk about the gut is the place where this thing. What happens if the gut is not good, which means our large intestine is not functioning well, right? What happens is the vagus nerve endings, which provide the bacteria in the gut along with the food, which creates neurotransmitters in our gut. The bacteria, the healthy bacteria, the friendly bacteria create neurotransmitters in our gut, which has receptors on the vagus nerve endings on the gut. So when the gut gets activated by the neurotransmitters, what are the neurotransmitters? Somatostatin, vasopressin, substance P, all the neurotransmitters are existing in the brain also. The same neurotransmitter, same quality, same receptor, same quality, everything same. So if they do not activate our vagus nerve endings, that vagus nerve cannot send signal to the brain. Because all the signaling is happening through neurotransmitter activating the receptors, which will pass on the action potential up into the brain. So if the brain area is not getting activated, for instance, the substantia nigra area in the brain, which is not getting activated, it will not produce dopamine for it to produce it to get all other connections happening in the brain. So because substantia nigra create dopamine in the striatum has connections into the motor cortex. This is the relay system always. It's always a relay system. So motor cortex does not get activated. As a result, it does not send signals to your hand movement or leg, everything. So this is the reason why gut is so important for prevention of PD. PD is nothing but Parkinson disease.
Parkinson disease. Yeah, that's what I was like, what that PD does, another name.
Yeah.
And by the way, there are another session everybody is requesting, Dr. Mayanil, so we are not going to let you go. तुम्ही परत तर तुम्हाला रिक्वेस्ट येईलच आमच्याकडनं.
Please do. I am available for that. This is my passion of life. I am dedicated 100% for this purpose.
कारण I think this session was not enough, not at all. आणि खूप लोकांच्या रिक्वेस्ट आहेत परत येण्याबद्दलच्या.
You can restrict the topic also. You said this is the only thing I would like you to discuss for 1 hour. Every slide can be discussed for 1 hour.
आणि पुढचा एक प्रश्न खूप चांगला आलाय जो ऍक्च्युअली गीता पाठक यांचा आहे आणि त्यांनी विचारलंय की can you guide on the best yogasana or regimen for young kids who are on the autism spectrum and have epilepsy issues?
Yes. Do this and do thak by thak 50 times. This is what you do in autism spectrum disorder. What happens in autism spectrum disorder is the left brain and the right brain, it is connected by a bundle of neurons, bundle of fiber. The bundle means it is connecting all the aspects of the right brain and left brain are interacting with each other. The left brain is interacting with the right brain, the right is interacting with the left brain. Okay. And that bundle is called corpus callosum. Corpus callosum is the one which connects to all these things. So in autism spectrum disorder, the left brain does not talk with the right brain properly. This is the first yogasana that they should do. It's not yogasana, it is just आपले thopu karnakam, South Indian temple मध्ये thopu karnakam. तुम्हाला, if you want to check it out, check in Google thopu karnakam, THOPUKARNAKAM. Ganesh Ji's temple मध्ये mostly you will see it. They do this and they do thak by thak like this. Almost all Ganesh temple in South or in India also, in Pune also, they do this. Thopu karna. What happens is this particular earlobe has activation center in the left one has activation center here and the right is having all that crisscross. So when you do this, let's say in our childhood days, when we were not doing well in our studies, our parent used to do this, right? Big time. What was the reason? First time they'll do this and the next time they'll do this. And it was now if you do, they'll call 911 here, right? That's not right. Because they were teaching us, they were actually activating the left and the right brain. The logical The fellow who is too logical, he is not emotional. Somebody is too emotional, never understands logic. So if you can connect both of them, learning enhances, right? The way. And that is basically the challenge with autism spectrum disorder. Second thing, this is one. Then Nadi Shodham, the left brain. I mean, you inhale through left and hold, exhale through right, hold, inhale through right, exhale through this alternate nostril breathing is very, very important for making left brain, right brain connections all the time. This is the best thing that can happen. We are doing simple stuff, but you know what is going on in a system is unbelievable. Such small system. And of course, you should always make sure whenever you're doing, you do all the pranayama with using Ujjayi. Ujjayi means you're fogging a mirror. Let's say if you're fogging a mirror, what kind of sound comes through? Like that. Just fog the mirror in front of me, and you see what kind of sound you get. It is actually coming through your throat, right? So, and instead of closing, opening your mouth, you exhale through your nose using the fogging mirror style. So this is how Ujjayi is done actually. So when you're doing alternate nostril breathing, or Nadi Shodhanam, you breathe in through constricted and breathe out constricted. So you will get double benefit from doing the Ujjayi. At the same time, you doing the Nadi Shodhanam also, making the left and right brain connection happen. Brilliant. It has been shown to reduce the problem of lack of focus or social challenges in autism spectrum disorder by doing this. This is very powerful, and hence I strongly suggest everybody do that.
Thank you so much again. Thanks a lot. Karan autism is becoming one of the other challenges.
Yes.
I guess तरुण मुलांना तुम्ही जे म्हणालात ना की त्या यंग एज साठी एखादा सेशन आपण प्रयत्न करू.
Young age is the most critical age because they are headed towards that. If they are following this, the thing is we ourselves do not know our own culture. Hence we cannot communicate with them, and then the इकडच्या culture मध्ये section आहे, they can get rocked right away. If we don't do our job well, mothers that's why I consider mother as one of the ultimate incarnation of godhood is mothers, because they are the first teacher of human beings. All mothers are the only teachers of all the girls in the family or the boys in the family. Father is hanging around, doesn't matter. But mother is number one. Number one is mother. So mother needs to teach their children these things from the beginning, very, very beginning in life. Once mother teaches, the sanskar of mother is imprinted in their genetics. They'll never get rid of that ever in life.
Thank you so much, Dr. Mayanil. It's 12:30, so it's end of the hour. Alka, should we end now?
Absolutely.
आणि आज खूपच शिकायला मिळालं. म्हणजे पंचप्राण डोळ्यात आणून मी बघत होते, ही जी फ्रेज आहे आपल्याकडे याचा खरा अर्थ काय? किंवा उठाबशा ज्यांना लहानपणी शाळेत काढायला लावले आहे ते चांगलंच झालंय त्यांचं.
अगदी चांगलं झालं.
आता कळतंय त्याचं की ते असं का सांगायचं करायला.
असं नाही सांगत, असं सांगतात.
असं करायला
इम्पॉर्टंट आहे.
खूपच छान आहे. आणि जसं सगळे म्हणाले की वी वुड लव्ह फॉर यू टू कम बॅक अँड टॉक अबाउट अनदर टॉपिक.
Yeah, give me a topic with a specific, one specific one, so that I can dwell on it real deep.